Knowing the 12 cranial nerves is the most vital assessment tool for nurses. Miss one check like papillary reflex or gag reflex, and you risk missing a catastrophic neurological change. I'm going to quick guide you through all the 12 by their anatomical groups and primary functions, showing you the exact practical check and required for each. So now, let's talk about the cranial nerve 1, which is the olfactory. It is a sense of smell. We can check if the patient has a head trauma or is reporting new lack of smell or anosmia. Now, we have cranial nerve 2. It is the optic. It is for the vision. Check the acuity using a chart, but also check the pupil's reaction to light because this is a afferent limb of reflex arc. Now we have cranial nerve 3, 4, and 6, which is the oculomotor, cochlear, and abducens. Yes, they are interconnected because they are highly interconnected and work in close cooperation to control the movement of your eye. It is the EOMs or the eye movement. The H pattern checks for coordinate tracking. Any sluggishness or limited movement can indicate a lesions in the brainstem. Now we have the cranial nerve 5, which is the trigeminal. It is a facial sensation and chewing with the sensation on the forehead, cheek, and chin to rule out the trigeminal neuralgia or stroke effects. Cranial nerve 7. It is the facial. It is a facial expression. Tell them to smile, frown, or raise their eyebrows. Because we are checking for Bell's palsy or stroke-related asymmetry. Cranial nerve 8, which is the vestibulocochlear. It is for the hearing and balance. We test the hearing, but remember, its vestibular component controls the balance and puts the patient at risk for falls. Now let's talk about the cranial nerve 9 and 10, which is the glossopharyngeal and vagus. It is for the gag reflex, swallowing, and vocal cords. These are very vital signs. We look at the palate rise to ensure the pharyngeal muscles are intact before we allow oral intake. Now, let's talk about cranial nerve 11, which is the accessory. Shrug your shoulder and turn head against the resistance. This checks the upper traps and sternocleidomastoid muscles weakness can mean spinal cord injury. And now, lastly, the cranial nerve which 12, is the hypoglossal. It is a tongue movement. Stick it out. If that deviates to one side, that's weakness. On the side, it deviates toward which cause speech and swallowing issues. Now, we're done, but now let's recall the all 12 cranial nerve and their function. Cranial nerve 1 is for the smell, which is the olfactory. Cranial nerve 2, optic, it's for the vision. Cranial nerve 3, oculomotor, is for the eye movement, eyelid, and pupil control. Cranial nerve 4, trochlear, it's for the downward and inward of eye movement. Cranial nerve 5 is the trigeminal. It is for the facial sensation and chewing. Cranial nerve 6 is the abducens. It's the outward eye movement. Cranial nerve 7 is for the facial. It is facial expression, taste. Cranial nerve 8 is for the vestibulocochlear. It is for the hearing and the balance. Cranial nerve 9 is the glossopharyngeal. It is the swallowing, taste, and salivation. Cranial nerve 10 is the vagus. It is a swallowing, voice, heart-gut control. Cranial nerve 11 is the accessory. It is the neck turning and shoulder shrugging. And lastly, we have the cranial nerve 12, which is the hypoglossal. It is the tongue movement. We have types of nerves, which is the sensory, motor, and the mix. In sensory, we have cranial nerve 1, 2, and 8. In motor, we have cranial nerve 3, 4, 6, 11, and 12. While in the mix, we have cranial nerve 5, 7, 9, 10. They are both sensory and motor. And that brings us to the conclusion of our presentation on the magnificent 12 pairs of cranial nerves. Thank you.